Hello, I'm Dr. Trevor Elmquist of Elmquist Eye Group, and I'm very happy to bring to Shell Point my partner, Dr. Sarah Eccles Brown. So we're going to talk a little bit today and let you get to know Sarah a little bit better. So Sarah, tell me, what brought you here and what is your education and background and how did you come to Fort Myers?
Well, I'm a Florida native, and so I knew always that I wanted to settle down in Florida. My family's still up in the Jacksonville area, and so it's nice to be able to drive there to see them. I grew up in that area most of my life and went to undergrad at Florida State. That's where I met my husband, Tony Brown, who is a neurologist here in the area as well. We went to medical school together up in New York, at New York Medical College, and that was where I knew for sure I loved living in New York City. It was amazing, such a great experience, but I realized that I am allergic to the cold and had to get back down to Florida at some point. My husband and I were both in the Air Force. We did the Air Force scholarship for medical school, and after medical school we went to San Antonio, and that was where I completed my ophthalmology residency training. And we really enjoyed our time there. We were both in excellent programs there, met a lot of amazing people. And after that, we were stationed in Eglin Air Force Base, which is in Northwest Florida, for 4 years.
Right.
And so Elmquist Eye Group was my first job as a civilian, private practice.
And I hope you're last.
Oh my goodness, I plan to be here forever.
Very good.
Yes, I feel so thankful that this is where I landed. I just am so thankful to be able to work with you and Dr. Wagner, Dr. Rodriguez, Dr. Burt. We have such an amazing team, and I really do feel grateful that we found the place that we're going to be and stay.
Well, thank you, and your presence is really appreciated. We do have a lot in common. I mean, military training in ophthalmology,
right. Yes,
and being Floridians, and not so much undergrad rooting for that.
I see your Gators tie there.
Exactly. So, after you came here, what things do you think were really important that you brought to our practice that maybe we weren't doing? New procedures and new diagnostic things that you might add to Elmquist Eye Group?
Absolutely. So we all have kind of our special area that we love. And for me, having been in the military for all those years, I was able to really give all kinds of lens implants, in the military, active duty, and in that population, it's all free. All these specialty lens implants, the patients don't have to pay for it. And it was so amazing for me to just be able to give what each patient, needed and deserved. And so I came to, really love that. And that's something that's a huge part of my practice is refractive cataract surgery and helping people to see better without glasses after their cataract surgery and really being able to tailor that to each patient. And what's been nice is at the same time that we're doing cataract surgery is now we can treat glaucoma with minimally invasive glaucoma surgeries, these MIG surgeries. So that is a huge, range of opportunity to help patients be less dependent on their glaucoma drops. I mean, the patients that we have on these glaucoma drops are on it every day for the rest of their life. They have to remember to get in that eye drop. The drops can have side effects. They may not tolerate them. They're expensive sometimes. And so if we can minimize the use of those glaucoma drops by doing a minimally invasive, surgery at the same time that they're already going to the operating room anyways, I mean, it's a win-win. And so...
Well, I don't mind saying publicly what I've told you privately is that your outcomes are world-class. And, I've looked at your outcomes from refractive cataract surgery. As you know, refractive cataract surgery is a huge part of ophthalmology itself.
Absolutely.
And the expectations of patients rise each year as we get better and better, which is fine. We want to try and meet those expectations. And I'm so proud to have you on the team, meeting those expectations and exceeding them many times. So I've compared your numbers to nationally known cataract surgeons, and you're right there with them. So Thank you for that. So there's an interesting thing though, you know, there's MIGS and there's all these letters like IPL. So tell us what this new IPL is that we just acquired at Elmquist Eye Group.
Right, so IPL stands for Intense Pulse Light,
Okay.
as you know, and it is a procedure where we put in some eye protection, and a handheld device is used several times over the face, and it can be done in the area just around the eyes, or it can be done as a full photofacial. It can be used in other areas, the hands, the neck, and it's a treatment that's used by many different specialties. Dermatologists use it, but it has recently received FDA approval for dry eye treatment.
Perfect.
And we know dry eye syndrome is something that affects so many of our patient population. It affects me. I use drops every day.
Oh, really?
For dry eyes, absolutely. And there is no cure for dry eyes. And so this is something that people struggle with their whole life long. And we want to be able to have the best options available to help treat people with this. When I was stationed at Eglin Air Force Base, we amazingly were able to get a package approved. I got the IPL on base and was
Okay.
able to use it for many patients there. And so I'm so thrilled to be able to offer it again, because I know firsthand the
Okay.
benefits that I've seen patients have with this. For those who have bad blepharitis, it's been FDA approved for a long time for rosacea.
Right.
And we know that ocular rosacea is really very similar, the same kind of process as blepharitis, this inflammation of the oil glands in the eyelids that contributes to burning and stinging of the eyelids, things that, you know, patients often experience every day, and they don't even know there's a name for it, or certainly that there's really good effective treatment for it. I mean, I know you and I tell so many people every day you need to use warm compresses
Yeah,
for your
I do
eyes
too.
every day. This is like maintenance, you know, for your eyes, just like flossing and brushing. We need to do warm compresses and clean our lids and lashes with eyelid hygiene. But it's so hard, you know, for them to do that every day, I feel.
Well, I've had it, believe it or not, I've had the intense light to my face too, and it's helped me. I'm going to continue it, I think, with you being my doctor.
Absolutely,
And so I
absolutely.
need some of that too as I'm getting older, and I get some of those rosacea-like dry eye symptoms
That's
as well.
right.
So where do you see yourself in the next 5 to 10 years as we go forward, and new things come out in ophthalmology all the time? So just describe the practice of your dreams for the future.
Right. So I plan to be at Elmquist Eye Group for sure.
Okay.
And again, you know, feel so thankful for the great team that we have. And we are in such an amazing field. Ophthalmology is
for
so
sure.
full of technology. We are continuing to, you know, learn and grow and have all these technological advancements. So I'm excited to see what types of lens implants are coming out in the future. The technology with that is just always growing, and you know, we're able to offer even better vision to our patients with cataract surgery. Certainly I'm excited with the IPL to be able to grow that, because I know that it works so well and can give so much relief, especially with, you know, continued treatments over time. And you know, just excited to see all the different things that come out that we can offer our patients.
Well, I hear the passion in your voice for eye care. And the good news is Dr. Eccles Brown does come out to the Arbor Medical Clinic
That's right.
once a week. And so you can see her there. So if anyone has any interest in seeing Dr. Eccles Brown and addressing some of these eye problems, call us at 936-2020 at Elmquist Eye Group. So thank
That's
you.
right. I'm there every Tuesday afternoon.